Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hi, my name is Untitled. Welcome to Natural Alternatives. Today, we're going to spend just a little bit of time talking about a syndrome that we see commonly in this clinic, and many times people even have to go through surgical possibilities for it. But in our case, we see it from a totally different perspective than what you might normally think of, and it's called femoral nerve pain. And so these are some very easy short videos or papers that I took rather off the internet that show where the femoral nerve root comes from L2 and L3, or the second and third lumbar vertebrae in your low back, and it comes through from the back into the front of the pelvis and into the leg. The common symptom that we will see associated with this is this kind of burning hot red pain, this irritation that'll be in the front of the thigh or the leg in here. And it can affect them to the point that not only is there pain and irritation, but also they'll notice weakness, a lack of strength going up and down stairs, particularly going upstairs. And that irritation is created by the fact that this nerve is being encroached and trapped. And so one would ask the question, how or why? Well, of course, there's the concept that it could be coming from a disc or something in your low back, but in reality, we see, because of a very simple physiological fact, that it's almost always muscle. And the reason for that is that it is 6 times more likely to entrap or encroach or impinge a nerve within muscle than it is a joint, bone, or an articulation. And it's just because of the sheer number of muscles that are throughout the entire human body, but also because of the fact that these nerves or innervations have to pass through muscle to get to an area. So thinking about the fact that this nerve root is coming from her lumbar, going through her pelvis into the front of her leg, there's one muscle that really acts on this, and it's called the psoas. So we have both the psoas major and we have the psoas minor. These are 2 muscles that pass from that same exact area in the low back and transfer down into the front of the hip. And if I'm going to demonstrate very simply, but it's a muscle that gives you a lot of power, so if you're standing, to be able to lift your leg up and control. So imagine that as you're going up and down steps, or particularly up steps, you're engaging that muscle regularly. And let's say that this muscle is injured, compromised, or contracted in some way, shape, or form to irritate that nerve. Well, the hard part about the psoas is that it angulates from the back of the body here into the front of the body here. And it's very difficult to reach or to massage or to address it. But yet with microcurrent therapy, which I'm going to show today using an electroacuoscope, we can affect this muscle very powerfully. So on her, I have this pad, the negative set of the pad, set up over the top of where the psoas would insert, and also where the nerve root passes through. And I've got the other part over her low back, which is close to that L2 nerve root. And so what I'm going to do is very quickly and very briefly go through, and we're going to treat this area of burning pain on the front of her thigh. But again, I've got the probe now set up so that it's actually in the positive side of the channel. So I'm going to be running a fair amount of electricity and current going through this area to try to help affect this femoral nerve pain, because this is a very common thing that we see in our clinic and often misdiagnosed. Sometimes, though, in fact is bad enough that it justifies surgical intervention because there might be something wrong with the lumbar. But also in our clinic, we have 3 other associates that are here: Dr. Mark Wheaton, Dr. Dave Gothenburg, and Dr. Dave Andrus. The 2 Dr. Daves are chiropractors, and Dr. Mark is a sports medicine physician. So sometimes we see that it's also an issue of something being out of place or contracted in the way involved in the skeletal system, that a chiropractor is necessary. Then also Dr. Wheaton can fit into this equation because many times there's an issue of lumbar instability. Maybe the joints are unstable, the ligaments are very weak and damaged in this lumbar, and it's also causing additional contraction of this muscle, which then is creating this referral pain. But many times we see that neither of those 2 things are present, but in fact there is contraction of the psoas. So this little demonstration today is to help you realize that there's other alternatives, other things that you can try to see if you're suffering with this particular pain syndrome, because it can be very debilitating. And again, burning, numbness, tingling, referred pain can shoot even down into the leg further once it starts to engage other nerves and other muscles. But at Natural Alternatives, we use what is called electrobody therapy. This is the machine that we have in our clinic to be able to go through and affect these type of muscle injuries very effectively. And again, we welcome you and encourage you to have an opportunity. Give us a call and see if you're suffering with this pain. This is something we can help you with. So again, thank you for listening.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.